Hey everybody, my name is Elisa. We're back. We're going over the male reproductive system, and this time we're going to talk about the penis. The penis in the reproductive system serves to deposit semen in the vagina during copulation. So half of the penis is actually on the inside of the body, and the other half is on the outside. It's the visible area. The external portion, when it doesn't have when it's flaccid or non-erect, it can be around, say, 4 inches. And then when it does receive like excess blood supply during erection, it can actually elongate to like a quite substantial, between 30 to 40% larger, depending. And that's in both diameter as well as length. The skin over the shaft, because of this change in size, rapid change in size, has to be kind of loose because we need to be able to expand. So in the West, especially, we have a high rate of individuals who are circumcised, which means that there's actually that loose skin is going to go and fold over the top of the penis, and it's known as the foreskin. And it can be removed, so it's just a state that you need to kind of know about and whether or not that's going to be medically relevant in your treatment of the individual. It has been known to lead to a development of slightly less sensitive epidermis on the glands due to the exposure. Smegma is a waxy secretion that is produced by the sebaceous glands in the glands on the surface of the precipice. So it's like a secretion. It's kind of protective up there. Three cylindrical bodies of the erectile tissue will fill with blood during sexual arousal or during reflex, and they account for erection. So erections do not always have to happen during sexual arousal. Sometimes it could be any kind of um, like reflex to touch or temperature change or any position change, anything like that. So it's not always elective, is the point. The single corpus spongiosum is along the ventral side of the penis. It encloses a spongy urethra, the penis component of the urethra, I should say. The distal end is actually going to be what forms the glans penis and enlarges at the end as well. The proximal end is dilated bulb. Um, and it is achieved by the bulbospongious muscle. Two corpo, meaning body, cavernous bodies, right? Corpo cavernosa, diverge kind of like arms of a Y, but they run parallel closely together. And each one, called a crus, is attached to the penis to a pubic arch, which is going to be covered with an ischio-cavernous muscle as well. We'll look at that in a little bit here in the diagram. The three cylinders of the erectile tissue are spongy, right? So they can change size, they can change shape. They contain lots of blood in the sinuses, and we refer to these as the cavernous spaces or the lacunae, right? Lacunae means cave. Trabeculae, meaning like kind of like the unformed lattice partitions between the cavernous spaces. So here's what it looks like in diagram. So in this cutaway, we can see it a little bit better. So here's the three, right? Here's the three segments that we were talking about. Okay, so this is dorsal component right here. So this is a dorsal, um, and this is ventral. So urethra is coming through ventral component. It does have its own corpus spongiosum around it. Okay, but also this is going to be some more of the erectile tissue here. So these are the corpus cavernosum, the two large, right? So they're parallel adjacent. So they can have like pretty significant blood supply changes. As you can see here, they have relatively large, deep arteries, right? They can really like transport blood relatively fast. They will empty out also into the venous system, which also carries like the nerves as well. There's also another dorsal artery, but that's why we have like a huge rush of fresh blood into the penis altogether, kind of filling out all of those corpus cavernosums, causing and allowing for that erectile tissue to kind of like stiffen, enlarge, and become stiffened and enlarged prior to copulation or as in response to a reflex. Median septum goes in the middle, just like you would have guessed right here, all together. Let me see here. Superficial fascia, right? Deep fascia. So these are connective coverings for the most part around the cavernosum and spongiosums all together. Let me see here, cavernous spaces. Yep, that's pretty much all I wanted to talk about on that one. Okay, so here is the glands of the penis, as you can see here. In this case, we're covered up by the precipice, right? So this would be removed in circumcision. Here's the external urethral orifice up here. Right, yeah, and this is just kind of like a nice overlay showing like all of the nerves and the arteries are always bundled anywhere in the body, but here it is for sure. And then here, of course, is that dorsal vein. Okay, all right, so I think that's pretty helpful. All right, so I hope that was helpful, and I hope you were out there somewhere having a wonderful day. Bye-bye.